How to stop urge incontinence during menopause. Imagine suddenly feeling a strong urge to go to the bathroom and not making it in time. This is a common experience for many women during menopause, but it can be managed effectively. Urge incontinence happens when the bladder muscles contract involuntarily, causing leakage. This often results from hormonal changes that weaken the tissues in the urinary tract. As estrogen levels decline during menopause, the tissues in the vagina and urethra become thinner and less supportive, making bladder control more difficult. To start managing urge incontinence, hormone therapy can be helpful. Local vaginal estrogen creams, tablets, or vaginal rings can improve tissue strength in the urethra and vagina. These treatments are usually applied daily for a few weeks and then tapered to maintenance doses. They are generally safe and effective in reducing urgency and leakage. Systemic hormone therapy, which involves pills or patches that deliver estrogen throughout the body, may also help with urinary symptoms but is less targeted. Lifestyle changes are also key. Bladder training involves gradually increasing the time between bathroom visits, which helps expand your bladder capacity. For example, if you usually go every hour, try to stretch it to an hour and 15 minutes, then longer over time. Pelvic floor muscle exercises, often called Kegels, strengthen the muscles supporting the bladder and urethra. To do them correctly, tighten the muscles you use to stop urinating, hold 4 or 5 seconds, then relax. Practice this 3 times a day with 10 repetitions each time. Diet and fluid intake matter too. Avoid bladder irritants like caffeine, alcohol, and spicy foods, which can trigger urgency. Spread your fluid intake evenly throughout the day and try not to drink large amounts at once. Maintaining a healthy weight can also reduce pressure on the bladder and improve muscle support. Medications can help relax the bladder muscles and prevent spasms. Anticholinergic drugs like oxybutynin and tolterodine are common options. They work by calming overactive bladder signals. Mirabegron is another medication that relaxes the bladder muscle, increasing its capacity. Be aware that side effects such as dry mouth or constipation can occur, so staying hydrated and eating fiber-rich foods can help. For more persistent cases, advanced treatments like Botox injections into the bladder muscle can significantly reduce symptoms. Electrical stimulation and biofeedback are other options that help improve pelvic muscle control. These therapies are usually performed by specialists and can be very effective. In some situations, devices like pessaries or surgery might be necessary, especially if other factors like pelvic organ prolapse contribute to incontinence. Pessaries are removable devices inserted into the vagina to support the bladder and urethra. Surgery can be considered if other treatments do not work and is tailored to each individual. Addressing hormonal changes, strengthening pelvic muscles, adjusting behaviors, and using medications or therapies can make a big difference. Consulting a healthcare provider who specializes in menopause and urinary health can help create a plan that fits your needs. With the right approach, you can regain control and reduce the impact of urge incontinence during menopause.